Assalamu alaikum. My name is Zoya Arif, roll number 182, and the topic of my presentation is schizophrenia. First of all, what is schizophrenia? Schizophrenia is a serious mental disorder in which people interrupt reality abnormally. Schizophrenia may result in some combination of hallucination, delusions, and extremely disordered thinking and behavior that impair daily functioning and can be disabling. People with schizophrenia require lifelong treatment. Early treatment may help get symptoms under control before serious complications develop and may help improve the long term outlook. And what are the symptoms of schizophrenia? They are negative symptoms: extremely disorganized or abnormal motor behavior, disorganized thinking, and hallucination delusions. And these symptoms in detail have been discussed by my friend. So the main topic of my presentation is the treatment of schizophrenia in pregnancy. So, attending antenatal care is important if you have schizophrenia because relapse is common during pregnancy, especially if you have stopped taking medicines. Your doctor or midwife can also give you information about nutrition and keeping smoking, illicit substance use, and alcohol intake in pregnancy. What is the treatment of schizophrenia during pregnancy? Talking therapy. First treatment is talking therapy before the medication. This treatment is used, which is can be very helpful in treating symptoms of depression and anxiety. They can help you recognize and change the negative thinking and feelings that depression brings. They also give you useful tools to stop anxiety coming back. And the medications for treatment of schizophrenia are the main medication called antipsychotics. These assist with symptoms such as delusions or hallucinations. Some antipsychotic also help improve problems of moods, thinking, and socializing, and anxiety or agitation. Other than clozapine, antipsychotic can be safely used during pregnancy. As some antipsychotic increase weight, it is good to talk to your doctor or midwife about managing your weight. What schizophrenia in children? As I've discussed, the treatment of schizophrenia in pregnancy, the antipsychotics are mainly used in the treatment of schizophrenia, even in a non-pregnant women also. But in pregnant women, other than clozapine, all other antipsychotics can be used safely. And in children, schizophrenia is a serious mental illness. It is a long lasting and disabling problem of the brain. A child with the disorder has unusual behavior and strange feelings. He or she may suddenly start to have psychotic symptoms. Psychotic means having strange ideas, thoughts, or feelings that are not based in reality. Schizophrenia is not often found in children younger than age 12. It's also hard to spot in the early stages. Often, the psychotic symptoms start in the middle to late teen years. Slightly more boys develop in its childhood, but by the teen years, it affects both boys and girls equally. How can we diagnose schizophrenia in children? The diagnosis is based on physical exam, test and screening, psychological evaluation, and diagnostic criteria for schizophrenia. These are the diagnostic criteria. Okay. Next is the case study in which it says a 26-year-old woman recently diagnosed with chronic paranoid schizophrenia is brought to the hospital after assaulting a neighbor. She presents in an acute psychotic state and has not calmed down since entering the hospital. She has stuck two staff members on the psychiatric unit, has had generalized tonic-clonic seizure since age 14, and currently is taking carbamazepine 300 mg TID. It has not been taking any antipsychotic medication and has been seizure for free for 1 year. She needs acute treatment with an antipsychotic because of her dangerous behavior. How should an antipsychotic be initiated to treat her schizophrenia in light of her seizure disorder? So the solution is antipsychotic drugs can lower the seizure threshold, producing seizure in patients who previously were seizure free. Seizures are most commonly with low potency typical antipsychotics and clozapine. Clozapine induced seizures are dose related. The seizures rate is approximately 1% at dose below 300 mg per day, 2.7% at doses between 300 and 600 mg per day, and 4.4% at doses above 600. because the patient is currently a danger to herself and to others. The benefit of antipsychotic treatment outweigh the risk. Strategies to minimize the risk of seizures should be employed and include slow dose titration, use of lowest effective dose, and possible concurrent administration of the anti-epileptic drugs. Haloperidol is an agent which, with a low risk of causing seizure, is a good selection. An initial dose of 5 mg per oral or 2.5 mg IM should be given immediately. And addition dosage should be carefully administered until the psychosis resolves or she is no longer dangerous. The decision to use scheduled or as needed medication should be based on whether she remained dangerous after a few immediate doses and the underlying cause of the psychosis. Supplemental benzodiazepam may be used to avoid high dose of haloperidol if necessary. The person carbamazepine should dose should be adjusted to maintain good seizures control, and serum concentration should be monitored. Carbamazepine can influence the hepatic metabolism of antipsychotic agent, so it should be monitored for recurrent symptoms of schizophrenia if her carbamazepine dosage is increased. Thank you so much.